All right, we're back on Morning Line. Thanks for joining us this morning talking about medical malpractice. As you see, the Kelly firm, and with me is Clint Kelly. He'll be answering your questions. He's the malpractice attorney. With him also, for the first time, you know, the voice on the phone that you call and reach her at his office is Kathy Farrell, a registered nurse. Nice to have you on, Kathy.
Thank you.
Good idea bringing her along. Like I said, it's good to meet her. Let's take a call now from Lisa. Good morning, Lisa.
Good morning. My name is Lisa Southall.
Yeah, what's on your mind?
Okay, my mother went into the hospital on September the 7th at the ER for, can you hear me?
Yeah, we can hear you. You go ahead.
Okay, my mother went into the hospital, Centennial Hospital, for her creatinine. Her numbers were up. And on September the 10th, they began to get down to normal. I think it was like 1.2. Okay, I stayed with her every day at Centennial Hospital, and on the September the 11th, she was going to be discharged because her creatinine, you know, was stable.
Okay.
I talked to her on September the 10th. She had called me and said, a nurse wanted to know what type of machine she was on at home to make it short. I told her CPAP. I thought that was strange because, you know, the nurse should have been able to look into her records since she had been there since the 7th. Well, on September the 11th, I kept calling my mother's room. She never answered the phone. So I decided to call one more time. Someone picked up her phone after 30 minutes. Said, is this her daughter? You need to get here. Your mother stopped breathing. No, it was about 40 minutes later. I had asked a relative, had they talked to her. But anyway, to make it short, we got there in 20 minutes. My mother was in ICU at Centennial Hospital. The room was spotless clean for a person who was supposed to be coded. On top of that, I asked the doctor what happened to her. He just said she had stroke. So I started investigating her death. I found out another doctor read her records for me and told me she was given Lovenox. So her death certificate stated she died of cerebral hemorrhage. The bleeding from the Lovenox caused her to bleed in the brain. So the doctor never told me that. Then I had a medical doctor also told me, because this doctor kept lying to me, Dr. Johnson. You can go to my Facebook page, Lisa Sherrod Southall, and read my story. He stated she just, you know, died of a stroke. So once I told him that with another physician who stated she died, you know, from the bleed of Lovenox, he said, well, I've been trying to tell you and your family that's what she died of. No, he never told us that. And to back it up, I had another physician even told me and a friend to take a tape recorder and record Dr. Johnson because he continued to lie to me. But anyway, so I ended up getting this attorney. He kept my mother's case for almost 7 years.
Oh.
So he kept telling me, Lavelle Gladden, it was time to...
I thought you said, so this happened 7 years ago?
Was going as planned. All of a sudden, he stated he did not have an expert witness. I investigated his expert witness, Dr. Lori Hornsby. After he asked to be off the trial, she stated, Mr. Gladden never gotten back with me.
Okay, Lisa, can you hear me? Can you hear me, Lisa?
Can you hear me?
Yeah,
Yes.
I can hear you. Did you say this happened 7 years ago?
Yes.
I thought you said September, but September 7 years ago.
Yes, but
Okay.
I'm just saying that we didn't get any justice.
Okay, I understand.
Let's talk about that.
Yeah, okay, let's talk about this case. And listen, hang on, and we'll discuss this a bit. What was the original, what is that she said she was in there for?
Looked like an increase in creatinine. Kathy, tell the audience what creatinine means, what it measures.
Creatinine is a renal enzyme, and if the kidneys are not functioning correctly, you'll have an increase in primarily two blood tests, creatinine and BUN.
Gotcha.
And so apparently this woman went in originally because she had some kind of kidney disease.
Gotcha. All right. And then it sounds like, you know, a lot of things went downhill from there.
It did, a cascade of events. I can tell you that if Lisa had called my office and had been referred to Kathy, the first thing Kathy would have done, she'd have realized this was 7 years old and then sent me a notice saying it's time barred. It is, because as we've said, Nick, many times, Lisa would have been obligated to file a pre-suit notice within 1 year of the date that she discovered some wrongdoing, either on the part of Dr. Johnson or whoever the healthcare provider is.
Now, it does sound like, Clint, though, that she may have done that with a prior attorney and maybe it went nowhere. Right. Would that mean the case could technically still be alive if it was filed?
Well, as I understand what she said, she went to Lavelle Glanton, and Mr. Glanton, who's an attorney here in town,
sure.
Did not have an expert for her, or could not get an expert for her. Don't know which it was, but she did not mention whether or not the case had been filed. It didn't sound like there was a case pending, and she said there was no justice, to which I infer from that she never got her day in court, unfortunately. And so, again, I want to remind everybody out there who's watching the show, if you think you've been a victim of medical negligence or a family member has been, please pick up the phone and call, because it costs you nothing. But if you wait too long to try to do it, you'll never get your day in court.
Did it sound at all like, based on what you described after the fact, there might have been a case here? And maybe this is one of those where it's difficult to get a good expert to testify to?
What'd you think, Kathy?
It's hard to say. I know you didn't get all the details there, Kathy.
There's one thing that caught my attention. She said that her mother was going to go home, or had been on CPAP, or was going to go home on CPAP, and that is a medical device that's used particularly at night for patients who have periods where they stop breathing in their sleep.
Sleep apnea.
Sleep apnea, and so the device blows air into their airways so that they have adequate oxygen at night. And for whatever reason, I don't know what it might have been, then she said something about her mother went into respiratory distress, meaning that she quit breathing. Now, I don't know how that's going to link in, without looking at the medical records, with there being Lovenox, which is an anticoagulant. It keeps your blood from forming clots. I'm not sure how we go from respiratory distress to giving Lovenox and that there being a bleed. Perhaps she quit breathing because she had had a stroke, and that's very believable that if she had a stroke, she might have stopped breathing, and perhaps they gave her some Lovenox and it made the area of the brain that was diseased or damaged during the stroke to bleed. That's one of those cases I'd have to look at those details and every minute on what was happening every minute and see what chronology these events took.
Okay. Cases like this, I guess, and who knows, trying to find an expert, and I don't know what happened in her case there. That's hard to do, isn't it, sometimes? I mean, to find an expert, and that's one reason, too. If you do find one, these experts, do they do it for free, Clint?
No, of course not.
Okay, so they don't. I mean, that's the point I want to make to our viewers, too, is sometimes they'll have an actionable case, but if it's not something that can be, where there's a big enough recovery, you can't really take the case, right?
Well, that's true if the damages are limited, but when you're talking about not being able to get an expert, it's usually not the problem for me to be able to find an expert. And if I can't find one, Kathy typically will.
Find one. All right.
The question is not whether you can find an expert. The question is, can you get an expert to sign on to the case and say, I believe this case has merit, I believe you should go forward with it? That's the question, because in that case with Lisa, it may have been a situation where her attorney, Mr. Glanton, had an expert look at it and say, this case is not meritorious. There's no negligence here, in which case you say, I don't have an expert, meaning I don't have somebody who sign on to the case.
Yeah, without an expert, I mean, almost all of these, if they go and they're being challenged, there's not a settlement, you have to have an expert in court.
There's only one time I've ever had with Kathy where I could not find an expert to look at a case.
But you always use one if it goes to trial.
That's true. Yeah. That's true. But in every other case, Kathy has been able to find an expert where I have not been able to find one to evaluate the case and give me an opinion whether or not the case has merit.
Interesting. I mean, it's just,
and that's part of what, because I'm certified, that's part of the advantage that I have over other attorneys who might do this work not as consistently as I do, is I do have access to experts and I can get a case evaluated, whether it's people that I know or people who Kathy knows. I will find somebody to look at the case and give me an opinion. And
for some of the more typical cases that keep coming through, you'll sometimes use the same expert more than once.
That's correct.
They're very good and they look at.
Well, you know, Nick, if it's a good expert deserves to be hired numerous times.
Yeah. Okay. And yeah, we've done some stories where I've talked to some of your experts before, where they lay out the point of view, and then the hospital's going to put on their own experts as well. Correct. So you may have two differing opinions. Is it subjective in these cases sometimes, and that's where the judge has to come into play after hearing from experts on both sides, like anything, I suppose.
Well, that's true.
Criminal cases.
That's true. Their expert, the defense expert, will do their very best to find maybe a different theory of what happened, or present an alternate theory of what happened that will be different from our expert, who will say, no, this is what happened in that case. And sometimes it does come down with which expert is the most credible, which one is believable.
Okay. One case that you and I have talked about that I think might resonate with some of our viewers if they've ever been through this, the situation where you maybe get a wrong prescription. Things like this. You hear about this sometimes happening, and mistakes happen, Clint?
That's the easiest case of all, because it doesn't take rocket science to figure out that you got the wrong medication, because you've got what was dispensed, you got what was prescribed, the two don't match. That's the error on the part of the pharmacy. And the case that I have is a lady who was prescribed a muscle relaxer, and then when she went to go refill the prescription, they gave her Risperdal, which is an antipsychotic, Kathy.
What?
And she took an antipsychotic and for some period of time and got injured, had to go to the hospital and get treated for it.
She was given an antipsychotic, which she did not need, and she was expecting to get the muscle relaxers.
That's correct.
Did she suspect anything weird about it when she, this pill looks like a different shape or size than the last ones?
She didn't until she started getting sick when her daughter looked at it. But Nick, the problem is nowadays when we get prescriptions, we don't know whether they're going to switch from one generic to another.
Oh, I know, you're right. They look different.
And so that's what's scary about it, is the consumer, or in her case, may look at the pill and think, oh, well, they just switched to another generic, and then find out it's the wrong pill.
Yeah. So wait, and by the way, would the label on the bottle have still been labeled a muscle relaxer, and they put different pills in there?
It was.
And so the target in this lawsuit is the pharmacy, not a hospital or necessarily a doctor who wrote the proper script. It was something that happened, a mistake.
That's right. Somewhere between the pharmacist and the pharmacy tech, there was a screw up, and this antipsychotic medication was dispensed into the pill bottle as opposed to the proper medication, which was a muscle relaxer. Now, the pharmacist is responsible legally for that mistake. They may have text running all over the place, but that's the pharmacist's job to make sure it's dispensed properly. Correct.
And you have some of the pills left over?
I do. I got pictures of them.
You have pictures of the pills?
Yeah.
And did you have to go test them yourself to make sure what the heck is this?
Well, there's no question about it. Even the pharmacist recognized that's what it was. She went back to her daughter went back to the pharmacy and said, what is this? And they said, yeah, it's Risperdal.
And the drug she was supposed to get, was it called something similar?
Yeah, it's like Raponilol or something. It's one of those funky names, but it's just a muscle relaxer you take for restless leg syndrome.
Is this something, and I know sometimes you litigate, you've filed something in this, is this something that's sometimes settled, or is there a defense for this?
There is no defense for this. It's just a question of what are the damages and what's the value of the damages. But it's something that's kind of a scary thing when you think about, because people do rely heavily on their pharmacy to get the pills right. And as I said, when these generic pills change their shape or their color, you don't think that's a different drug. You think that's the right drug, and
I got a question for you on that, on how maybe you can try to protect yourself from that when we come back from the break. We'll take a break. When we come back, our final segment with our guests. The number 737-7587. If you have a question or comment on a situation maybe you're dealing with, give us a holler. We'll be back right after this.